Hello everybody, welcome back to my YouTube channel. My name is Grace Anyango. I'm a registered nurse and today we are going to talk about stereotypic movement disorder. First, we're going to start with the diagnostic criteria. What do we mean by stereotypic movement disorder? Stereotypic movement disorder is basically repetitive, seemingly driven and purposeless motor behavior like shaking, waving, hitting yourself, and even biting your own body. Now, this repetitive motor movement always interferes with their social, academic, and other activities, and this may also result to self-injury. Onset is usually during the early development period. This repetitive motor behavior is not attributed to the psychological effect of a substance of any neurological condition, such as OCD or trichotillomania. Next, we're going to talk about how we specify this condition. It is being specified in two specific ways. One method of specification is behavior with self-injurious activities or behaviors without self-injurious activities. And the other way of specifying this condition is either mild, moderate, or severe. What do we mean when we talk about mild? Mild symptoms are easily suppressed and they're easily suppressed and you cannot see it, and it is always misdiagnosed or undiagnosed most of the time. And when we talk about mild, symptoms require explicit protective measures and behavioral modification. We will talk about management as we continue. And severe is continuous monitoring and protective measures are required to prevent self-injury. When we talk severe, it is intense, that basically these patients are not able to control themselves or these movements when if it is waving, hitting yourself, hitting your head, they can't control it, and mostly they will require protective measures so that they may not injure themselves. Okay, when we talk about injurious behavior vary in severity. Mild bruising or erythema from hitting ants against body. Lacerations are amputation of digits, like when you rub your hands so much. And retinal detachment, when you hit your head so much, when you hit your head, that may lead to, like, head banging may lead to retinal detachment. Now we will talk about self-restricting behavior. You know, most of these people know themselves because they're self-aware. They know they have this condition. So let's talk about the restricting behaviors that these people may try to use so that they may be normal or appear normal in the society. One is sitting on their arms. Basically, people are used to waving, hitting their hands, or hitting themselves. You'll find themselves when they're sitting, they'll sit on their arms so that this involuntary movement or behavior stereotypic movement may not overpower them. Another one is wrapping hands on clothing, when they'll try wrap or put their hands inside their pockets when they're having a sweater or a t-shirt in their pocket or the pockets of their trousers. They'll always figure out a way of hiding their arms so that this stereotypic movement may not overpower them. Another one, this movement might reduce anxiety in response to external stresses. Okay, let's say we've always seen people pacing around or doing like this, like when they're stressed. When stresses is one of the things that may intensify this behavior, like the stereotypic movement. So they avoid external stressors. Risk and prognostic factors. Environmental. When we talk about environmental, let us be okay. In other neurological conditions, when we talk about environmental, we talk about where the baby was developed, like prenatal, premature birth, when the mother was smoking or drinking. But when we talk stereotypic movement behavior and we talk about environment, we basically mean self-isolation may trigger stereotypic movement, and like environmental stress, like in the society, stress about life, you're in the hospital, you have a sick patient, you have anxiety of an upcoming exam or something like that, or at your workplace. These are the some of external stressors that may trigger stereotypic movement. Genetic and physiological. These are one of the things is family history. That is basically it. When we talk about genetic and physiological factors, then that is basically family history. If you come from a family that it has one or two people who are before you who attributed this behavior, who are diagnosed with this type of the behavior, then one is is predisposed to stereotypic movement disorder. And then what even fear is one of the things that can trigger stereotypic movement. When you're scared, when you're isolated, that's why we talked about self-isolation as one of the environmental factors that may predispose someone to stereotypic movement disorder. And then what will now next we'll talk about, oh, sorry about that. Next we'll talk about treatment. One of the things about treatment of neurological conditions, the one is behavioral therapy. They'll need therapy in regards to their behavior, because this stereotypic movement interferes with how they behave in the society or among the people around them. Next is medication. They'll basically need medication to control their nervous system and their motor behavior as well. Next is environmental modification. Now, when we talk about environmental modification, we have actually talked about two ways of specifying stereotypic movement disorder. One is injurious, and another one is one with injurious behavior and another one without injurious behavior. So when we talk about uh, stereotypic movement disorder with injurious behavior, these people will need environmental modifications sorry, so that they may not keep injuring themselves, like hitting themselves on. Okay, when we talk about surfaces that are hitting themselves, people who hit themselves with their hand or keep rubbing their hands somewhere or waving, they'll need like a glove so that when they rub their hands or hit themselves, they're not harming themselves, or the environment is basically modified so that they are not causing a lot of harm to themselves. Another one is physical protection. Like when we talk about, when I've talked about gloves, that is physical protection. So that, or helmets, people who hit their head, keep banging their head or hitting their head, they need helmets so that they don't injure themselves when they hit themselves, or they may not have retinal damage in the process of hitting their heads. So that is all about stereotypic movement disorder, and we're always coming to an end of neurodevelopmental disorders. We only have one disorder left, that is tick disorder. Yeah, that we'll tackle in our next video, and then we will talk about similarities in all the neurodevelopmental disorders. So that is all for me today, and bye. See you in the next video. Don't forget to subscribe and hit that like button. Subscribe, you all. Bye. See you in the next.